Thank you for the opportunity. My name is Scott Stafford. I am the Regent's employee also, and I'm a project administrator. And what I do at the company is to look for efficiencies and ways to lower the cost of and streamline the experience for our members and to lower those costs. I'm not currently in the sales role, but I have been before. I have sat across from individual members in the purchasing process of our individual products, and I understand what that experience is like for them and what impacts their decisions, the cost and the benefit selection, and the stability of a company, and its ability to assist the member after the purchase of that product. And I've never doubted my willingness to represent those products, nor would I if I was in a sales role now. The word sustainable has become very common in our language over the last few years. But it's clear that with a nearly $100 million loss in the individual line of business over the last 5 years, that it's hard to determine how long that trend can be sustained. Despite my own dislike for the increase, I understand that from the viewpoint of sustainability, that it needs to go forward. Despite the fact that my own prescriptions have doubled in cost over the last year with no changes in the prescriptions that I'm taking. The Regent's employees and the management spend a great deal of time talking about what our mission is as a company, and the word economic stability, as well as being a catalyst for change, come up with a tremendous amount of frequency. And we realize that we as a company cannot do it alone, and we are willing to team with anyone and anything that will help to fix a broken healthcare system. Few people can work for an organization in whose values they do not understand and that they do not share. I do believe in what Regent stands for. I believe in transparency. I believe in sustainability. I believe that we are doing our best to be a good steward of our members' healthcare dollars. I believe in educating on health and wellness and in working to fix a broken system. Regents employs Oregonians, and we do not consider our membership to be a faceless collection of numbers and statistics. They are our neighbors, they are our friends, and in many cases they are our family. As part of the community, Regent's employees are subject to many of the same financial pressures that every Oregonian is subject to. And sometimes we have to step back and make decisions that are difficult for our own families. As such, we do empathize with the members who are facing this increase and the cost of every increase in the cost of everyday items. But Regents...
You're going to have to finish up.
One more statement, I'll be done. But Regents must remain viable and sustainable company to serve the needs of our members, and that is the reason that this rate increase has been requested.
Okay. Thank you. Next panel. Is Ann Fisher here, by the way? We called her name and she didn't come up. Okay. The next panel, Dr. Esterman and Jack Turteltaub. And I'm going to call one more, Kenny Jones.
I'm Dr. Joe Esterman, live in Wilsonville, recently retired after 50 years of medical practice in Oregon. Came to Oregon in 1963, and one of the smartest moves of my life. There were questions that were not asked by Osberg. There were concerns that were not expressed by Osberg, either in their testimony today or on the website, which they certainly did cover some excellent questions and express some excellent concerns. But I have 14 that I want to present to you. I don't expect you to answer them now. I left copies of the 14 questions back in the comments box for your perusal later when it's more convenient. One of the reasons I'm here is that because of the estimated 50,000 people a year who die because of no access to basic health care, that translates to about 600 Oregonians every year who die needlessly because they have no access to basic health care. And that, of course, is primarily due to the cost of private health insurance. My 14 questions are as follows. One, what is the Oregon Insurance Division reserve requirement for Oregon private health insurance companies? Number two, what profit margins does OID allow for, quote, nonprofit, unquote, private health insurance companies? Number three, what medical loss ratio does OID require for individual policies? And why can it not be 90 to 95% for a so-called nonprofit? Number four, what has OID determined Regency's medical loss ratio to be in each of the last 3 years? Number five, what percentage of claims were denied by Regents in 2010, and what was the total dollar amount of those denied claims? Number six, what was the percentage and number of applications for coverage declined by Regents in 2010? Number seven, what is the status of guaranteed issue for Regents? Number eight, what were the costs of principals' compensation? Some of it, I know have been over $1 million in some cases. Advertising, meetings. I was dismayed to see one of their recent meetings was at the Ritz-Carlton Laguna Niguel establishment, which says a lot about the mindset of the corporate world, unfortunately also including insurance companies, and the cost of their PAC contributions for the last 3 years. Number nine, what procedures and outside experts does OID use in its review process? I couldn't find that anywhere on the website. Number 10, what does OID do to reduce the cost of premiums, and what success has it had? Number 11, can OID control premium costs as is done, for example, in Vermont? Number 12, what does OID require Regents to do to reduce or control waste, such as duplication of services and equipment, fraud, for example, overtreatment by providers, and abuse, for example, overcharging by providers and equipment manufacturers? Number 13, where can one find OID rules and regulations for the private health insurance industry? I couldn't find any of those on the website. And number 14, have the three of you read Deadly Spin by Wendell Potter? I suggest it be required reading for all OID personnel. Thank you.
Thank you. Okay, thanks for your comments. Go ahead. And sir, you're welcome to come up to the table now. Okay.
You were next.
I want to thank the Commission for having this holding. I appreciate it. Thank you. My name is Jack Turteltaub. I'm a private citizen, and I pay 100% of my premiums as a self-employed person to Regents Blue Cross Blue Shield of Oregon. My insurance premium does not pay for a spouse or any dependents. While I appreciate the high quality of health care that I receive, I will use my own personal example to explain why I am deeply opposed to this unreasonable rate increase request. My understanding is that average health costs are increasing at a rate of about 7 to 8% per year in the United States. Yet, in the past 3 years, my individual premium has increased by 90%, from $4,000, less than $400 a month in 2008, to $7,500 today, or $629 a month. Having absorbed this 90% increase in my premiums, I am opposed to an additional 22% increase, or even a 10% increase, because Regents Blue Cross Blue Shield is a company flush with money, and it is profitable. There have already been at least 4 rate increases over the past 3 to 4 years. The last year, the company added over $1 billion to its investment portfolio. I am 56 years old, generally healthy in spite of an inflammatory condition, because through regular exercise, good diet, stress management, good social support, and good medical management, I take care of myself. Yet now I pay, including my out-of-pocket expenses, about $10,000 in annual medical costs, even though I have not been hospitalized, have had no major surgeries, or taken any highly expensive drugs, experimental or FDA approved, in the last 3 years. I see a doctor 3 or 4 times a year, take 2 reasonably priced medications a year on a daily basis, and had one fall, an accident in Hawaii last year that resulted in about $1,000 in urgent care, follow-up care that was paid 90% out of my own pocket. I cannot comprehend how I am already paying 15% of my annual income, about $10,000 a year, and now may have to pay more than $1,500 additionally per year, not to mention possible out-of-pocket increases. I shouldn't have to pay any more than what's fair to help pay for the underinsured or the uninsured in Oregon. And so I'm asking you again to not approve this rate increase, and I'm asking you to work to reform our health insurance care system so that payment for this is more equitable. Thank you very, very much for your time.
Okay. Go ahead.
Hi, my name's Kenny Jones. Thank you for the opportunity. For the record, I'm not a Regents employee. I'm a self-employed small business owner. My wife and I, both of us, neither of us have health insurance. We can't afford it. But even if we could, I'm not at all certain I would buy health insurance. I don't wish to participate in and perpetuate an inherently flawed system. There are so many reasons why our fragmented private health insurance non-system is inferior to a national universal single-payer system. Many of these reasons can be found at the Physicians for National Health Program website, pnhp.org. I'll give you one reason here. Between Medicare, Medicaid, the VA, and other federal programs, 60% of all healthcare dollars in this country are already publicly funded with taxpayer dollars. The population that receives health care on the public dime are the oldest, sickest part of the total population. Why don't taxpayers cover the younger, healthier population as well? You just heard Jared from Regents testify that, quote, we need a whole lot of Kyles. Precisely. Any actuary would agree. Few actuaries would argue against a risk pool that included 100% of the population. That is one of the reasons why a national single-payer system of health care makes economic sense, because everybody's in, nobody's out. Every other developed country in the world has figured this out, and 37 of those countries have better health outcomes than the United States does by almost any metric, and they do it for far less money. Thank you.
Thank you. Okay, so our next panel of witnesses, Susan Fitzgerald, Betsy Zucker, Kevin Grant, if you're still here. Are you still here? Yes, okay, good. And again, you can go ahead. Who's ever first up?
In the interest of making sure everyone has equal access, I'm a Regents employee as well, but I'll be real brief with my comments. So,
and your name is?
My name is Kevin Grant.
Okay.
And one of the things I wanted to say was I think it's very refreshing to see this kind of engagement and this type of turnout for this event. These days, it's very easy to sit behind a computer and take a poll or fill out a survey and be very comfortable and anonymous in doing that. So I think it's, like I said, the term refreshing came to mind when I saw the outturn and how people are engaged in this process. As I said earlier, I'm a Regents employee, and I'm a Regents employee also when I leave the office. So when I go to my son's soccer games, or when I go to the market, or when I go to my daughter's daycare, or my appointments for my mother with her doctor, I'm a Regents employee during those settings as well. And I'm a proud employee because I feel that I'm more educated in the process than maybe most people are. A lot of information, statistics, and numbers have been thrown out all throughout this session. And I think it was refreshing at the end of Jared's message to also be looking forward for some solutions. And I get to share those with my neighbors in my community every day. Previous experience for me, I worked for a previous carrier about a decade ago, and we were forced with some complex decisions to make, not easy at all. And we had to actually take a team down to a county in Southern Oregon and actually remove a product from that area. It was highly disruptive. It was very emotional, and it was not a fun process at all. So as we go forward, I'm very proud to stand by a Regents employer that is dedicated to being there, and I believe Jared's words were committed for the long term and be a part of the solution.
So next, whoever wants to testify next.
Can you hear me?
Yes, we can.
My name is Betsy Zucker. I'm a nurse practitioner here in Portland. I'm also a parent. I have Blue Cross insurance through my job, and I have a daughter for whom I bought an individual plan last year, which was a very intimidating process. I'd like to make two kinds of points to you today, and I'm very appreciative that the insurance division has had this hearing. The first is challenging the numbers and this rate increase. In brief, healthcare costs around the country have gone up by whose study you read between 3% and 7% every year. Those are healthcare costs, and we're being asked to approve a 22% increase after multiple double-digit increases. So there's something other than the cost of healthcare going on. The second number that I'd like to bring to your attention is the one that you've already heard about, the reserves that Blue Cross has. They've gone up almost 3 times in less than a decade. They're now more than 3 times the legal requirement for the reserves. I understand that the insurance division needs to look specifically at the individual plans. Is there enough money? Do the premiums cover that? However, Blue Cross functions as a large corporate entity with millions of dollars in reserves while people cannot afford basic health care. That needs to be added into the mix. The other point that I'd like to make is as a member of the Jobs with Justice Healthcare Committee. We're a group of healthcare advocates that have been looking at how can people afford healthcare? What kind of system works? The private insurance-based healthcare system simply doesn't work. Blue Cross is doing what it needs to do as a business. That's its job. Its job isn't to provide healthcare for the public. Its job is to continue to be a successful, financially stable company. We need a publicly based healthcare system. Insurance is to protect us from things that aren't supposed to happen. If I have a car accident, if there's an earthquake, if my house burns down, it is not the way to fund something that everybody in this country needs. We do need publicly funded healthcare system. And I'd like to have the idea that everyone deserves healthcare added into your decision today. Thank you very much.
Thank you. Okay.
My name is Susan Fitzgerald. I am a Regents employee. I came to Regents about 6 years ago knowing really next to nothing about insurance. I still don't read my policy either. I call customer service when I need a question answered. But one of the things I've learned from working at Regents is that I need to start asking questions. The thing that I think everybody agrees on is healthcare costs a lot of money. It costs more than a lot of people can afford. And I started at Regents to learn how to start asking questions of my doctor and say, what does this cost? And she looks at me kind of funny and she said, but it's covered. I said, yeah, but somebody's still paying. And I've also learned a couple of hard lessons from not asking questions. The cost of a prescription that was so high, and I pay out of pocket because I have a high deductible plan, that the pharmacist apologized to me and said, I'm sorry, can you pay this? And I said, I guess I have to. But it's so. But I feel very fortunate that I do have some insurance. But one way to make it affordable for everybody is for us all to start asking questions, whether we have insurance or not. When we go to the doctor, if you don't have insurance, you have to ask how much it is. But when you have insurance, you still have to ask how much it is because you're still paying. And somebody's got to pay attention to costs. I also have friends and relatives that I have to explain these things to, and they say, well, why are you guys doing this? How can these things be possible? And I've learned a heck of a lot from reading in the last 6 years. And no matter what kind of system we have, the medical costs are still going to be there because we all still want to go to the doctor. We all still want the medication that we want, and we all still want the test that we think we should have and that our doctor thinks we should have. Those costs aren't going away no matter what kind of system we have or who signs the check. So we still have to ask those hard questions about costs and what we really need. That's it.
Thank you. Okay. The next panel, is Chris Lowe here? Okay, Chris Lowe, Pam Alley, and Kathy Birch.
Thank you for having these public hearings. I am formerly a graduate student in public health at OHSU, and also I work with the Portland Jobless Justice Healthcare Committee. I want to preface the next thing I'm going to say by saying I do not question the individual motivations of people who work in the insurance industry and their good faith and their effort to do the best at their jobs as I understand it within the constraints of that industry. Nonetheless, I have two basic framing things I want to say. The private insurance industry is a racket in which insurers benefit financially, insurance companies as entities, not the individuals, short term by restricting medical treatment in various ways, regardless of medical need. And the second point is that I have a strong belief that this rate increase is part of a wider pattern of insurers across the country in the individual and small business markets jacking up their rates as rapidly as possible before 2014, possibly in collusion with some providers, in order to establish high baselines for government subsidies under the Patient Protection and Affordable Care Act when they come online in 2014. And we've heard about the decline in the population served by this market. That's going to shoot way up when PPACA comes into effect and the individual mandate comes into effect. And I think a lot of this is about profits down the line. The most recent issue of the Lund Report provides an interesting report about group insurers in Oregon committing to work with providers to restrict rate growth and premiums, I guess, to 5.5% for the group market by 2014. This contrasts in an interesting way with everything we've heard today about the individual and small business market, in which we're told that the insurer has no option but simply to pass through the cost demands that are put on them by providers. I think that's nonsense. I think they could negotiate. I think it's your business to limit their increase in order to force them to negotiate. Secondly, I wanted to address the blame the government cost-shifting myth that was in the Regents' presentation. Provider service charges are not only based on the costs of actual or prices of actual services provided, considered as wages and salaries for medical personnel, costs of facilities and equipment, and costs of medical materials, which may or may not be justified. That's a different issue here. But providers also face overhead costs for administering complex claims and billing systems related to both patients and insurers that approximate 20%. These overhead costs arise from the incredibly complex Rube Goldberg machine of private insurance billing and administration. Similar costs for Medicare and Medicaid are about 7% at the high end of estimates for that, and some of the literature goes lower. And I think if you plug that into the Regence's numbers, you'll find that reimbursements from public programs are at worst a wash and probably actually subsidize the administrative costs that the private insurance industry is imposing on providers. So the cost shifting is going the other way. Thirdly, Regents, like other private insurers, are keeping premiums low or less unaffordable by hollowing out their benefits, raising deductibles, copays, and coinsurance. This pattern undermines wellness, primary care, prevention, and early-stage disease management. People get diagnoses but are forced to self-ration less expensive early care because they cannot afford the cost sharing under lemon insurance plans. I think that we were hearing a lot about people need to take responsibility and look what they can afford in their individual circumstances, but we have to understand that when most of the population can't afford the care that doctors recommend to them, that pushes it down the line to much more expensive forms of care later on.
Can I get you to finish up?
Okay. Well, my last point then is just to say I agree with what the insurance companies said. The system is broken. I think the insurance industry itself is part of that, and that I would urge you as public officials, insofar as you may be involved in policy debates that we aren't privy to really take up this question of a picture we're getting here today from all sides of the debate of a system in crisis that is collapsing around our ears. It's not sustainable the way that we're going. And you've got your job to do today, or in the next few weeks, but we need you in there to be advocates for some really much more dramatic change in this whole nonsense.
Thank you. Okay, go ahead.
My name is Pamela. Can you hear me okay?
Absolutely.
Okay, I'm here to testify on behalf of a friend today who can't be here. And I chose her among the living because there were many people I could have chosen, but she actually asked me to be here. Laura McElhaney, my old friend, although she's 10 years younger than I am, she's on OMIP. I hope it's not totally inappropriate for me to use my 2 or 3 minutes on this. She's a type 1 diabetic, and she has a limited income, a fixed income actually, which would have been okay, but her catastrophic only insurance through OMIP, which is the Oregon Medical Insurance Plan, doesn't pay for her maintenance cost, and her premium costs have been going up every year. I think it pays about $5 a month for her maintenance cost. So a few years ago, Laura started cutting back. She started with heat, okay, and then food, and and then her doctor visits, which she should make as a type 1 diabetic in her 50s, and her testing equipment, and her insulin. Laura is, I won't say she's dying, I think she's being murdered. Okay, that was a bit of a soapbox, and I know you told us not to do that. But a busted healthcare system isn't just a bunch of numbers. It's people that are suffering and actually dying, all different strata of society. So I hope you consider that. I'd like you to remember my friend Laura, and also my partner who went through a medically caused bankruptcy, who hasn't had insurance for about 10 years, and myself, I've been unemployed, so I haven't had insurance for over 5 years. Fortunately, I will be able to get Medicare for the 20% that's worth. I'm definitely going to use it sparingly because we don't have any money. So think about single-payer health care insurance, please, or don't even think in the term insurance. Insurance and health care are diametrically opposed, period. That's my real soapbox, so thank you very much.
Thanks for your story. Go ahead.
Hi, my name's Kathy Birch, and I don't have the expertise that many of the speakers have had this afternoon. I'm sort of like the tall man in gray who's been paying for a single Blue Cross policy for a long time. And before that, I spent 20-some years as part of a group on Blue Cross. So I was Kyle for probably 2.5 decades before I had to be Martha for a year, or whatever her name was. And so I sort of resent the idea that, Martha and the other older gentleman are the problems and Kyle is the good guy, because most of us become Martha gradually. And I also wanted to dispute the thing that the man said, we haven't had any rate increases this year. My Blue Cross policy went up 9% in February, and the idea that it'll cost most of us $25 a month more at 22%, I figure mine's like $152 more per month. And like the tall man in gray, I don't have vision, and I don't have mental health, and so just one person's story. And I support many of the people who are looking at broader issues, but I think in terms of Blue Cross as a whole, those of us who are buying the product need to go ahead and push on the company, because the company does have PACs and lobbyists, I assume, so they have a role in solving the problem in a large way, and our role is to work on the problem here at home. Thank you.
Thank you very much. Next group, Diane Frank, Ann Aiken, and Herman Frankel. Are you folks still here? Great. And again, I want to encourage anyone who has not testified, or even if you have testified, to submit written comments to the division. Go ahead.
Hello, my name is Diane Frank. I have been self-employed most of my adult life and have always paid for my own health insurance. I am 62 years old, healthy, and have always been a very light user of the healthcare system. As a small business owner in Eugene, for many years we provided health care for our employees. In today's market, these same employees would either be self-insured or uninsured. In October of 2007, my health care premiums were $275 a month. Only 4 years later, they are close to $600 a month, an increase of more than 100%. With another 22% increase, that would take them to $732 a month. That is on top of a $2,500 deductible and the first $10,000 of any major medical procedures coming out of my pocket. With the exception of state-mandated coverage such as mammograms and an annual physical, I have and continue to pay for virtually all of my health care out of my own pocket. These increases are financially crushing people like myself, and it is simply, and I'm using the word that so many people have used here this evening, unsustainable. Individuals and the self-employed are bending under the burden, but now we are actually beginning to break as healthcare premiums take an increasingly high percentage of our monthly incomes. And if our incomes are modest, that percentage has a major impact on our lives. Individuals and the self-employed have few choices and virtually no leverage. We are limited in our ability to shop around, and most of the companies charge similar rates regardless. If you have a pre-existing condition, you cannot leave your company. And if you're in my age group, other carriers will not accept you as a new member. Lastly, if you apply to another health insurance company and for coverage and are denied, your current carrier can drop you, regardless of the reason. We are held hostage by this system. I imagine that many people in my position are hanging on to their health insurance premiums and paying them not because they can afford it, because they have an asset such as their home to protect and simply cannot afford to take the chance of losing it to accident or unexpected illness. I would like to know why Blue Cross and Blue Shield is not changing group rates but asking this 22% increase to be borne on the backs of individuals and the self-employed and not being pooled with the other members that are part of the larger pool. I would like to know why, I would like to have them held accountable with fact-based and verifiable numbers to justify the cost of these rate increases, and I would like to know why, until recently, this process has been so lacking in transparency and accountability. I would also like to know why Blue Cross Blue Shield is using ratepayers' money to sponsor the Umpqua Pro-Am golf tournament and the zoo concerts to the tune of hundreds of thousands of dollars and can still justify raising our rates 22%. Lastly, I would be curious to know if the CEOs of Blue Cross, Blue Shield, any other health insurance company CEOs, and their lobbyists for that matter, were put in the position of paying 30% or more of their monthly income for their health insurance premium if meaningful changes in the system would not be implemented. The system has become deeply and profoundly flawed, and it is simply unsustainable to continue in this manner. It is not unreasonable to demand that health insurance companies be held accountable for any rate cut and that the process become more transparent. Otherwise, people like myself will no longer bend, we will break, and that will no doubt bring tragic consequences for far too many ordinary and hardworking families. Please deny this increase. Thank you.
Thank you.
Thank you.
Okay. If you could identify yourself, please.
My name is Dr. Herman Frankel. I'm a pediatrician. My wife and I have lived and worked in Portland since 1965. There's little that I can add that will increase the force of the testimony that you've already heard, calling upon you to refrain from approving this requested rate increase. As a pediatrician, I think in terms of protecting people's health and well-being. And in the short term, it's very clear that defending the reserve pool of a very successful corporate entity is at odds with protecting the reserve pools of the people who pay premiums to that entity. Because the people who are purchasing individual insurance don't have reserve pools. Assuming good faith on the part of all of the people who've testified today, I think that if in truth the decision-making people in Regents Blue Cross and Blue Cross employees are convinced that they cannot continue to function without getting a 22% increase from holders of individual contracts, then indeed it's time for them to do what they say. They're ready to work with everyone to create a system that will work, that will provide everyone with equal access to high-quality medical care. A system in which the expenses for every clinician and every hospital need to include personnel to be fighting with insurance companies for permission to provide care for their patients, need to be submitting separate complex documentation to each insurance company. We need a system in which the dollars that policyholders pay are not used to pay the costs of lobbyists, who are not used to pay the costs of skillful public relations people, are not used to pay to settle cases out of court when fraud and other criminal behaviors have been documented. A system that will not pay for medical care insurance companies to meet the legitimate expenses of competing with other private medical care insurance companies. If indeed the good faith that I assume is present on the part of everyone who has testified today, then the task is for all of us to work together to create a nationally funded medical care payment system so that everyone will be able to have access to medical care of his or her choice, vision care, mental health care, drug and alcohol care. Everyone will have equal access to high-quality medical care, everyone in, nobody out. Let's keep working together to make our world a better place, a safer place, a healthier place, one interaction at a time. Thank you.
Thank you. Thank you very much. Is Ann Aiken in the room? Okay. I'm going to bring up the last 4 folks who have signed up. Janine, I think your last name is Coles. Is Janine here? Okay. I may have butchered your last name, but it's the only Janine on the list. Linda Kofer. Okay. Lisa Henning. Okay. Okay. And you're Lisa. I am. Okay. You can. Well, come on up to the.
Okay.
Come up to
the
mic.
thing I will mention is it's come to my attention that the fellow who spoke from the Regents Group, I'm a former TRG employee in the legal department, and it's come to my attention that they spend a lot of money and a lot of company time coaching him to testify before you all today, and I think that that's a misallocation of funds. They have also cut back on their fraud and abuse departments within all 4 states. So that also doesn't help cut costs or manage health benefit dollars. I think we really need to look at where those health benefit dollars are going. There's like the patient, there's the provider, and then there's insurance in the way. Insurance is an obstacle to care, the way it's being created and managed and administrated, quote unquote. I say that ironically today, and it needs to change. And Regents is not doing anything to change it or improve it or qualify it. And I could tell you stories, but I won't bother you with it. I will just send some letters and give you some testimony via letter, okay?
Thank you.
Mm-hmm.
So last person who has signed up is Baxter Gillette. Mr. Gillette here. Okay. Is there anyone else who has not testified who would like to testify? Okay. Well, this is going to conclude our hearing. As we went over earlier, you still have an opportunity to submit written comments, either electronically or in writing. There's an opportunity to do it at the back of the room. And in addition, on the back of the agenda, there's a hearing survey. We'd be really interested in hearing your thoughts on how this hearing was conducted, any suggestions for improvement. It's very important for us that we get this feedback from you. So thank you all for coming.